And now Kenyans have joined the rest of the world in commemorating the World AIDS Day amid calls on stakeholders to step up efforts aimed at lowering infections in the country. Health Chief Administrative Secretary Mwangangi says Kenya can only defeat HIV through a multi-pronged approach that covers increased awareness, action and resources. This year's event was held in Kajiado, where the local county government unveiled an ambitious plan to end mother-to-child transmission of HIV and syphilis by the year 2024.
Kenya is banking on technology and renewed efforts aimed at combating HIV and AIDS prevalence in the country. The government says though it is making numerous strides in the war, a lot more still needs to be done.
We have put in place different measures, and that is why we are here today, because these 57 deaths are not acceptable. To come together to raise awareness, to come together to advocate for more action, for more resources, for more interventions when it comes to HIV/AIDS.
The country is making strides in HIV and AIDS testing and has launched its first HIV self-testing automated vending machine. The machine, which is on a pilot phase, will be combined with virtual counseling services provided through a call center manned by qualified counselors.
Launching an ATM. And Governor, this ATM, unlike the one that we popularly like, that has money, this one is one that is going to give us self-testing facilities. It will also be attached to virtual counseling services provided through a call center that is manned by able counselors. And all we need to do is get a kit and dial 1190 or download the application to be able to then get support in this use of the ATM.
Health Chief Administrative Secretary Mwangangi, in calling for multi-pronged approach to the war on HIV and AIDS, said the country has made a significant progress in HIV response by reducing annual AIDS-related deaths from 166,000 in 2007 to 20,997 in 2019.
Kenya has made successes in reducing the prevalence of HIV, moving from a high of 14% in the 90s to the current 4.5% in terms of HIV prevalence.
The commemoration, which was held in Kajiado, saw the county government unveil an ambitious plan to end mother-to-child transmission of HIV and syphilis by the year 2024.
We are today launching the Kajiado County HIV and AIDS Profile and Kajiado County HIV and AIDS Strategic Plan, both of which present critical data to aid in policy decisions.
To ramp up efforts to end HIV in the country by investing in programs that will help guard vulnerable citizens from the virus. Meanwhile, in Nairobi County, AIDS Healthcare Foundation called on the government to allocate more funds to HIV and AIDS programs in order to create HIV and AIDS awareness, mitigate the spread of the disease and run support programs for HIV patients.
So it's a reminder that we still have HIV and we still have a lot of strategies that we need to put into place to make sure we close the tap on this other end, that is reduce new HIV infections, and also on this other end identify the people who are living with HIV. If you look at, for example, Kenya, we have a lot of donor dependency. And that's why even as an organization, our advocacy department is very key on domestic funding.
In Mombasa, Jomvu Member of Parliament Badi Twalib called for the protection and facilitation of community health workers who play a critical role in the management of diseases such as HIV and AIDS.
I want to call upon the county government of Mombasa health workers who are working tirelessly under very hard conditions.
According to the World Health Organization, over 38 million people are currently living with HIV globally.